When people ask me what clinical crown lengthening is, the first thing I like to explain is there's 3 types of crowns that we talk about in dentistry. The first crown is the natural crown, the anatomic crown, the crown with a portion of the tooth that's covered by enamel. That's the portion that you see when somebody smiles. The second crown is the prosthetic crown. It's the crown that we get from the dental laboratory. In many respects, a dental crown is like a thimble. It's like a thimble that sits over your finger. But this is a thimble that looks like a tooth, and it fits over the tooth structure that's been prepared to accept it. Then the last type of crown is the clinical crown. And that's technically any portion of the tooth that we can see above the gum line, whether it's technically the crown portion or the root. If we can see it above the gum line, that's the clinical crown. It's very important to have adequate clinical crown to work with. Sometimes the tooth is broken to the point that the dentist does not have enough tooth structure to work with. Sometimes the soft tissue is overgrown, such that we can't get to the tooth to work with. Some cases are simpler, and some cases are more complex. This is a more complex case because this case is with a young woman who has a rare condition called amelogenesis imperfecta. With this condition, the enamel either does not form properly or it does not form at all. And so what you have is just soft, weak tooth structure, which leads to problems with function, leads to pain, and it leads to an appearance that is, well, let's put it this way, not very nice. And this affects these patients' lives. In fact, there's literature that says that if a person has a significant dental anomaly, that they may be bullied more at school. It really inhibits their personality from coming out. And that's what happened to this young lady. In this case, Dr. Woodside did careful evaluation to determine what tooth structure that he could work with, what had to occur in order to restore this mouth properly. After that evaluation and careful treatment planning, he then gave me his wish list in terms of how much tooth structure he needed to expose in order to get the final restoration. So what I did here with this clinical crown lengthening, and I'll warn you, the details may not sound nice, but people do incredibly well with it. What I do is make incisions in the gum line, move the gums back, then I alter the shape of the bone. This really isn't hard work, it's more like artwork. It's more like finesse, which allows me to put the gums back in the proper position so that the restorative dentist, and in this case Dr. Woodside, can create beautiful restorations. After I'm done, he placed this patient in provisional restorations. We left them there for a few months to make sure that the soft tissue healed beautifully, that we were happy with the shape of the crowns, that everything remained healthy and stable. And this is the final results that we were able to achieve. And as I may have mentioned, this case was published in a dental journal and we got a wonderful response. We could see the change in this patient's personality as she went through treatment. Her beautiful personality just came out. Her parents were thrilled. And as it turns out, I unknowingly was treating another member of this person's family, and they told me it was unbelievable about how much the patient's personality changed, improved, her confidence improved. And one of the most beautiful things that happened to me was that family member showed me a picture of this patient at the prom with her boyfriend and a big smile. This is one of the most favorite procedures that I do that give me the greatest amount of satisfaction. And this is really, truly what we call life-changing dentistry.